Thank you guys for being here. Friday at 11. Violet, let me give you permission to record. There you go. All right. County, obviously, not going to be here. They don't have any new numbers. I believe Eddie's in another meeting. I've got the numbers that they updated yesterday around 5 p.m. 480 confirmed, 254 probables with 734 total cases. So that number keeps going up. Russell, do you want to go over the MCH numbers? You need me to do that?
I've got them, but let me, Dr. Bidden, on the county side, do you have anything or?
Sure. I do have a few things to update from the county's perspective or from the health department. So yes, we don't have the numbers up yet today. That has to do with data entry staff and the overwhelming incoming positives. So the data entry staff are also having to double up doing other duties and contact tracing and so forth. On the good news side, the health department has hired 6 of the 15 positions that they've offered. Of course, that'll take a little bit of time to get them trained and fully up to speed. Also, they're going to be doing a few more things on the Facebook page. So if you'll join up with the health department's Facebook page, you'll see a little more activity and more information, hopefully to help clarify some things. And then they gave me some numbers on nursing homes. There are 4 nursing homes in Odessa that have had positive cases. 2 of those have had very recent cases in the last few days, and there are 14 people pending at Parks for test results after 1 positive there. And at Sienna, there have been 4 cases, and there are 6 others that are undergoing testing and are symptomatic, but are being isolated. There have been 18 cases at Focus Care and 1 case at Deering's. The other thing we need to address is trying to clear up a few things from the last press conference about testing and probables. Hate to venture back into all of this, but I believe word was put out last time that all antigen tests were listed as probable, and that's not true. Our health department is following the guideline where if you have an antigen test, then you also have to meet criteria of either being exposed to a known positive or being symptomatic. So those are the only people being listed as probables. And the other thing, not all rapid tests go into the category of probable. Some rapid tests are PCR, and any PCR test that is positive is a confirmed case. The probables are becoming overwhelming. So, I think Dr. Sarah Bannon showed us last time that is a 2nd tier level for case investigation. So they have investigated some of those, but having trouble getting to all of them. So that's what the health department had to share this morning.
All right. Thank you, Dr. Benton. We appreciate that. Russell, you want to go over the MTH numbers?
Yes, sir. So I've got our numbers here that
I didn't know I wasn't supposed to shout out names.
Let's see if somebody needs to be on mute here. Okay, I think we're good now.
I got it. 263 positive cases so far, 23 in house today. That's another, I don't want to call it a record, but it's the highest we've had here. 18 of those are on 7 Central, which includes 2 from Big Bend, that's Alpine, 1 from Ward County Memorial, 1 from Reeves County Hospital, 1 from Focus Care of Odessa, and 1 from Focus Care of Crane. On our CCU floor, we have 5. 3 of those are on the ventilators on our 5th floor. Includes 1 from Ward Memorial, 1 from Big Bend, and 1 from Focus Care of Odessa. We have 1,940 negative tests We still have a big number of pending, 481 tests pending out there. And we do not have any suspects in-house, but so far we have tested 2,684 is what we tested. And so that's the numbers. Kristen, do you have anything you want to add to that?
No, I don't. We're just seeing a large number coming into the emergency room. So my only request would be that we do something about the mask, something with the hand washing. I mean, the people going out into our community is spreading it quickly, and it's getting to where our ERs and our floors are becoming full very rapidly. So just to tag on to what you said of please encourage people to mask up.
Thank you, Kristen. Stacy, would you like to go over the RMC numbers?
Yes, thank you, Trevor. Odessa Regional has tested 813 individuals. We have 59 positives, 571 negatives, and 180 pending. We only received about 5 of our test results from yesterday back when we tested close to 60 people. So it's definitely getting bogged down and taking longer to get those results. In terms of who's admitted to the hospital, we have 9 patients. All of those patients are in ICU, and 2 of them are on a ventilator. We did have, of the patients we currently have, 7 of them came from home, 2 of them are from the Crane Nursing Home. Just so you know, our numbers have stayed relatively constant, but it's not the same patients. We did have 2 discharges yesterday and 1 death with 4 new admissions. And so they're continuing to turn over. And that's all I have, Trevor.
All right, thank you, Stacy. Russell, you have one more thing before we get to media questions?
Yeah, I was just for the media and Mayor, probably for you too, we received notification this morning that CPL is going to stop their non-critical testing. So that is the lab here in Odessa where I know we send a lot of tests to, and I know this may affect like the drive-through testing and things like that, but they are so overwhelmed that non-critical testing, we're hearing they're going to stop that for 10 days. And so that is going to probably change the way where we all ship our tests to and what we do. But I just thought that was very interesting that they've become so overwhelmed there that they're going to have to shut that down for at least 10 days.
All right, thank you, Russell. I'm sorry we're reconnecting to Facebook here again since it cut out. Mike, looks like you're first up on the list, sir.
Yeah, thank you. Dr. Ben, I had a question for you. What would the health department need to be able to inform the public on a daily basis again?
Need time to catch up and need more employees, I think, would be the biggest thing. It's just a matter of getting through the volume of work. Obviously, they count the numbers and we'll keep the data going. It's just, throughout the day and into the night, some of these staff are working. They're putting in long hour days, 6 days a week, sometimes 6.5 days a week. So it's just volume of work.
Okay. And I guess to learn that the lab, the CPL lab is only doing the more serious tests. That's kind of interesting to hear. Are they doing overtime? Are they working Monday through Saturday? Do you know about the hours that the state and these other labs are working? And
I don't know what their hours are. I can only imagine that they're functioning like everybody else right now, and they're just blowing and going as much as they can. I don't know any specifics on that, but I know anything that's related to healthcare right now is wide open and is going all the time.
And I agree with Russell. I don't know the hours that our local CPL or the national CPL works. However, in the communication, it was said that they would just give them about 10 days to get caught up, then they would relook at what their capabilities are. I think that the thousands that they received at one time has just kind of put them on a backload.
Right. Well, thank you for that. And Dr. Benton, a lot of the comments on the health department Facebook are about how people are having a hard time reaching out to anyone who works there. Is there a good place or number for people either trying to reach the health department or people trying to apply for one of those positions? Is there a good place for them to reach?
Actually, I don't know that number. That's a great question. So let me find that out for you. And I'll try to get Brandy to send that notice out to you so that you can put it out. I'm not sure of the administrative details, but the hiring is, I believe, done through a hiring company. But I'll get Brandy to get that information for you.
Well, thank you, Doctor. And I got a question from a reader here. Between ORMC and MCH, how many beds do y'all have left for COVID patients on designated floors or on CCU or ICU?
Can you say that again, Mike?
Yeah, it was about bed capacity. I guess, if MCH has one number, they wanted to know about both MCH and ORMC. So I was just wondering how many beds y'all have left for COVID patients on designated floors or on CCU for MCH.
So we have a bed capacity in our CCU of 20, and we currently have 7.
We have 5. We have 5 in there.
I'm sorry, 5. And then we have the 18 on our non-critical care floor, but we have the capacity to hold 30 on that floor. At the point of our beds that are currently open getting full, then we move into what we call our surge plan, where we move to different floors so that we have maybe 2 floors instead of just 1 floor. We look at our procedures. We look at our outpatient surgery area and using them as critical care beds. So we have a plan to serve up to 40 to 60 more critical patients. However, it comes in stages. So if you look at what we have as of today, it would just be those numbers that we have on those particular floors, and then we would move into expanding that.
Okay.
Does that answer your question?
That does. Thank you. Ms. Brown, do you have anything to add to that?
Yes, we have 10 beds in our ICU, and again, we currently have 9 patients, so we have 1 bed remaining in the intensive care, but we do have additional units as well, so our surge capacity from an ICU perspective is an additional 20 to 23 beds. So we still have capacity as well. Like Kristen said, it is surge capacity. And again, as we've mentioned before, I think our biggest challenge will be if we start pushing those limits is not so much the bed availability as it will be the staffing to get those beds staffed.
Can you guys hear me?
Yes.
Yes.
Okay, so sorry I'm late. I can expand a little bit more on that. We do have our regular ICU, which is the 10 beds. We opened up a COVID unit that has 15 beds. That COVID unit has been open since the COVID surge started. And those 15 beds currently are where the COVID patients are. So we have just about half that capacity still left. And then for surge, we have 24 more beds on top of those. The 15 beds can all function as ICU beds. The 24 surge beds are all just regular med surge floor beds that can take care of COVID patients. So that's our current.
Okay. Thank you. How's ORMC doing on test kits? Y'all got everything you need?
Yeah, so yesterday, all of a sudden, we started running very low on test kits for sendouts, the ones that we would collect and mail out to CPL. We heard from CPL that they were unable to supply us many more test kits yesterday. They'd usually give us about 50 to 60 a day, and since the outpatient testing site at the community health center was now very busy, we were doing 60 or 70 tests overall for the hospital, including the ER as well as the outpatient testing side. So our inventory started running very low, and then CPL didn't have any more test kits to give us. So we were scrambling yesterday. Today, we got a new shipment in of several hundred more test kits. So we've been replenished as of right now. But our outpatient testing center, we actually temporarily closed because we didn't know when we would get shipment in. So we'll probably reassess and maybe reopen the outpatient testing center on Monday if we still have enough test kits at that point.
Okay. Thank you. And for Mayor, I noticed there's been some pushback on the potential mask order. Some even from a MCH board member who wrote on the OA Facebook that the only thing different about this virus from others is massive liberal media and government overreactions. Is that why you haven't authorized an order yet? Is there hesitation for political reasons?
No, the reason we pushed we're going to have a meeting 10 o'clock on Monday with council, bring the experts in, discuss with them, because I can issue the order, but we have to make sure that council understands everything because they have to approve it in 7 days. So that's what we've decided to do. You know, I've gotten a few threats. You know, it's just part of it. People are very frustrated. They're cooped up, and it's just part of it. You know, with what's happened in the last 24 hours with the governor is exactly what we didn't want to happen. We cannot afford to close this city down because we have 16% unemployment. We have to keep these people employed, but we have to get the numbers to slow down. We've had, you know, June 11th in my Facebook Live, there were 258 cases. Right now, there's 734. So we've had 300 cases this week alone. You know, at what point is the governor going to say, Odessa's got a problem and we need to send them in? We need to send in the care team. You're already seeing it in some other cities, and that's my biggest fear. So.
Okay. And what day again were you going to say that you're looking into a meeting?
It's going to be Monday at 10 o'clock.
Okay. And that's set then?
We should have she should have already sent everything out.
The agenda is on our website, Michael.
Perfect. Thank you, Devin. Appreciate it.
Sorry, Mike, real quick. Mayor, did you have any more info you wanted to put out?
Yeah, if you haven't heard, governor has taken a step back. Restaurants will be reduced from 75% to 50%. All bars that receive 51% of their income from liquor sales will be closed today at noon. He has also closed all of the commercial rafting and tubing on all the rivers. And so he's also said any gathering in excess of 100 will have to be approved by the local entity. And so there are a few other restrictions as far as the amusement parks and things like that. But this is what really scares me is the governor taking steps back, because it will decimate our economy if we have to start closing things down again. And so that's something we really need to be concerned about.
And I just got one from a reader, Mayor, about the governor's order, actually. And I don't know if anyone could speak on this because it's about the carnival that's at the Coliseum. Is that something that would be shut down? Is that a question for the county?
I think that's a question for the county. I can, okay. I've just highlighted the highlights on this one. So it's something the county will probably have to look at, or at least restrict the amount or the capacity.
Okay. And then I noticed there was some confusion last time around when bars were supposed to close and say like the game room next door was allowed to be open. Is that any clearer this time around?
Game rooms are to be held at 50% of capacity.
Okay. All right. And that's all I had. So thank y'all.
All right. Before I get to Danny real quick, Dr. Benton, did you want to add something more about testing sites?
Yeah, so the health department and the county are adding a few testing opportunities. The National Guard is coming back. That will be July the 1st and the 2nd. And texascovid.org or 512-883-2400 are points of contact for that. The also on July the 1st, well, yeah, that's the National Guard testing is coming back, and that's through the state and not CPL, so that shouldn't be interrupted.
Is that everything, Dr. Benton?
Yes.
Okay. All right. Thank you, Danny. You're up next, sir.
Right, Mr. Mayor, would you consider reaching out to TxDOT and coming up with some signs that reflect the need for, or to remind visitors to the city to wear masks and social distancing?
I can talk to TxDOT and see. John Speed has been very good to help in anything that comes up. I can reach out to him and ask. I'm not sure if they have the ability to have them made in a quick time frame. Usually signs like that take a couple of weeks or even a month, but I will reach out to John.
What about electronic billboards? Could you do something like in the next few days and try to post them up?
We're working on the marketing plan for the testing that we will be doing, the 8 in the summer and 8 in the fall. And so I believe part of that is going to be involved in that.
As far as restaurants, could you have the health authority or maybe law enforcement there are several restaurants I know that the wait staff and also some of the management, they don't wear masks. Could you enforce that? I mean, at least tell them to explain to them the problem with not wearing masks and not social distancing.
Well, if we don't put an ordinance in place, we actually can't do anything. It is up to that individual. If it's a chain, it's up to their headquarters. If it's a local restaurant, then it's up to their owner to wear a mask or not to wear a mask. So we're very limited in what we can do.
Okay. What do you think the economic impact is right now on the city as far as sales tax and other monies that might be coming in?
Well, we're waiting for the May numbers, which will really start to give us an idea. It's been down 20-25%. It scares me that we're taking a step back from the governor as far as he has frozen any more openings and probably going to hold this for, if I was guessing, at least a month to 6 weeks. It's just less people going into retail stores, and that's less sales tax. We as a city are actually looking at what we're going to have to do to make up the sales tax shortage. And, most of the taxing entities are concerned.
How do you feel that the current administration wants to do away with testing or funding, federal funding?
Well, unfortunately, it's an election year and everybody's talking about, we want to do this, we want to do this. And, I believe it when I see it, but I think it would be a mistake to take away the national testing because you're putting it all in the states and all in the municipalities and the organizations.
Okay, that's all I have for today.
All right, thank you, Danny. Scott, you're up next, sir.
Come on. Thank you, sir. Devin, good morning. The Monday meeting.
Yes.
Are y'all going to do that in City Hall?
Yes.
Okay. So
No, it's actually going to be at the PAL gym.
No? Okay. It's going to be at the PAL gym. I haven't seen the agenda. I'm working with Norma. She's working with legal to make sure it's everything's good with the Open Meetings Act, and then we will have it posted.
Right. And if we wanted to take it, go ahead. I'm sorry.
We just want to have enough room.
Sure.
Social distance, and at City Hall, we're kind of short, have short on seats there anyway. But once you take out what you can, we can only fit about 20, 25 people in there. So.
If we wanted to take it live at 10 o'clock Monday, we'd kind of be on our own in that location, right? It'd be up to us.
Yeah, you probably have to talk to Devin.
Yes, Scott. So, yeah, since it is the PAL gym, I'll try to see if we can get something like maybe have it streaming on YouTube or something. We're working to see our capabilities on that, just because we know that some people still want to be involved, and we don't want anyone to come who doesn't feel comfortable for any of our meetings. So yeah, I'll figure something out and I'll get back with you this afternoon.
Awesome. Mayor, while I have you, explain the difference in your mind between an executive order and a law now that we're going backwards. If I'm a bar owner and I don't agree with the governor this morning, what might the city of Odessa do to uphold that executive order? Are we back to where we were, or are we going to be stricter this time, or what do you think?
No, I think what will happen is the TABC will come in and pull their license, their liquor license. That's what's happened in Lubbock. TABC has been very active here in the last 2 weeks, where bars are not following what needs to be done, and they have actually pulled the liquor license in one bar in Lubbock for 30 days. If they catch them again after those 30 days, they pull it for 60 days. So TABC is very active. If we have one within the city that's not following it, Mayor Payton and I had already discussed calling the TABC out for some of the bars where a lot of people are getting ill. We'll just call the TABC and allow them to handle it. Because a fine is one thing, but pulling your liquor license is a whole nother thing.
Oh, much more serious, sure.
So.
Dr. Benton, you were talking about the shortage at the health department, and then we were talking about 16% unemployment. What kind of specialties do you need on your resume to have that one of those jobs at the health department? And is there a way we as a TV station could help connect and alert people who are unemployed to perhaps apply for these jobs?
Absolutely. I'll hook you up with the health department for that. We'd love the coverage on that. I don't know the exact requirements, but they're not huge. What we need is contact tracers, and the health department will train them. But that merely is calling people and identifying, when were you in contact with this person, and informing them and educating them about the protocols of what to do when you've been exposed. And the health department and all the staff there will train them. The people that are doing it are pretty experienced now, 4 or 5 months of doing this, so they'll bring them along pretty quick.
Great. Let's plan on doing that. My final question, and I wanted to get everybody's input. We did a story on it yesterday, in that Ector County gives us positives and probables, and we've been separating those out. But the CDC says you should put them together. If we start doing that today, Ector County is suddenly going to have 200 plus more people than Midland. The numbers aren't going to be anywhere near each other again. Are we all good with that? Because we're told that's what the CDC wants, right?
I'm good with that. The ones that the health department are listing as probable are real cases. They are COVID virus. And the health department is following the guideline where if you're antigen positive tested and you've been exposed or have symptoms, then they're putting you in the probable. Actually, if you look at the dashboard, the main page dashboard, all of them are put together. Just there's a sentence underneath that says, these are combined numbers. We have reached out, or the health department has reached out to the state, to DSHS, because the state is just reporting confirmed for Ector, and we're getting clarification from them. But we do believe that putting them together as we've done, but clearly separating absolutely confirmed by PCR test is the truth of the matter. So, but they are real cases. The other thing, there was some confusion in this forum last time about what the health department was doing with probables and how they were defined. The state did reach out to the health department after that press conference and confirmed that indeed the health department here in Ector County is doing exactly as they're supposed to. So reconfirm.
Very good. That's all I have, Trevor. Thank you.
All right. Thanks, Scott. And Mitch, North Public Radio, you're next.
Yeah, I'm curious, Dr. Benton, concerning the confirmed cases, would there be any consequences from the state if you were combining antigen into the confirmed numbers and then reporting that to them?
I'm not sure. I mean, I think it's important that confirmed as defined by CDC is PCR positive. So a PCR test is confirmed, but we are reporting them all up as should be.
Perfect. Thank you. And I guess to the hospitals, it sounds like, space is always a concern, but that staffing is becoming a concern as more cases come in, and how many staff would be needed if you were to be pushed to your surge capacity. What are your plans to staff up if a wave hits and you have to go into your surge plans?
So as for medical center, we have, of course, a list of employees, and we have our disaster readiness plan from many years past that we are required to have, where we have a call tree. And so every employee not working, we call them to see if they can come in and what their availability is. And you'd be surprised, many staff just step up because they know that that's what they're called to do. We have some contacts with agencies where we would bring in some of those people depending on which area we're trying to fill. And then, of course, we reach out to, when it gets to an extreme, your first responders that are off, your school nurses that might not be employed. So we do have a lot of extras that we reach out to in those planning stages so that we can get them credentialed, if you will, to work at our facility in a timely fashion.
And for Odessa Regional, it'd be very similar, the same steps that Kristen mentioned, but we would also, and we've already begun to do this just to find ICU trained nurses, is reach out to the other facilities in our system. We have 37 hospitals as part of Steward Healthcare. And so if you recall, back in April, we sent 5 nurses and a respiratory therapist to Boston to help when they were surging. And so we would also reach out to those resources to try to get those here as well.
And some of that stuff, Mitch, is already being done. As Stacy said, like we have nursing leaders that we meet with on a regular basis that are in our universities. For instance, Texas Tech, their nursing leader pulled a lot of us together between myself, Stacy's CNO, the Midland Memorial CNO, and then all of the university nursing program leadership to say who would work extra, what are their skills. So we have those lists combined so that we can collectively put that stuff together and start pooling between whichever facility needs the staff.
I guess my follow-up would be is it fair to say there is a concern, especially as Texas as a whole sees a rising in numbers, that finding specialized people with the skills that you may need for critical care COVID cases may be in short supply like that? Is that a real concern right now?
I don't think currently it's a concern, at least not from medical center standpoint. However, you're correct. They are in short supply, those people that are trained for critical care. And so at that point, that's why we have to protect those people that are not at the bedside but have those skills. Your educators, your nursing leaders, to include even myself. I mean, because we have to be able to step back into the bedside in order to care for those patients if we get to a point where we can't, or we're waiting on those critical specialized skill staff to come in.
And I guess one of my final questions is for Mayor Turner. Mayor, you said you've been threatened. What kind of threats have you received concerning a possible mask order?
Oh, it's just the same ones. You better not do this and things like that. It's just par for the course.
Like political, nothing like,
exactly.
Okay. And I guess, Midland last night said they were just going to ask their residents to take this seriously and to start wearing masks more, and they're not ready to go through with a mask order. I guess from your perspective as a local leader, what do you think it's going to take to put the fear in people for them to start taking this pandemic seriously in West Texas?
I think that's the $1 million question. Unfortunately, when things go longer than a month, people kind of lose interest. They move on to something else and they quit listening. And that's part of the challenge as a city, is to be able to, use advertising to break through those and not just be noise, to actually be a message they listen to. And so that's what we're trying to do with a marketing campaign, coming up with some commercials. When I was growing up, they always had, this is your brain on drugs, and they opened an egg into a skillet. That always got our attention. So you're looking at doing something similar. It will make you think. And we are also the chamber has put together a focus group to talk to the 20 to 29-year-olds to be able to say, what is it going to take and what's the best way to communicate with you and to get you to listen? Because, we all know that has been the fastest growing age segment. And so we're doing a lot of research and, just trying to come up with different ways to make people listen.
And I guess my final question is, Mayor, with the governor kind of stepping back on opening things up, are you as the leader of the city, is the city government preparing for a possible rollback? You said that's the worst case scenario for Odessa right now, but how are y'all preparing if that happens at this point?
Well, we as a city are actually talking about limiting staff again to be able to, rotate people through. That's just something we are talking about as a city, but, rolling back scares me, honestly, more than the disease, because what it'll do economically, especially with unemployment as high as ours. We need to get people back to work. And so we're just looking at the plans now and really listening to the governor. He's been really good on some issues and been a little soft on some, we believe. But we believe closing the bars is a good idea.
Perfect. Thank you.
You good, Mitch? All right. And I think the only one else I see in here, Violet, do you have any questions?
Hey, good morning. Have a couple of questions. I think most of them have been answered already. I was going to ask a little bit more on how these numbers are being reported to the state. I know you said that they were getting in contact, the Ector County Health Department was getting in contact with the state about that reporting. So currently, have they only been reporting confirmed cases, or have they been reporting both, and has the state been doing that split?
Both categories have been reported up, and the state is only publishing the confirmed, and we have reached out to them today to clarify that between the two.
Okay, thank you. And then you guys talked about the mask ordinance. Yeah, I think that's everything. I think we've clarified everything else. Thank you.
All right. And one more question I saw that's been asked several times on Facebook. I guess it would be toward the mayor or county. We have any more updates on possible school reopenings? I mean, I know August seems like 2 months away all the time, but it's rapidly approaching. Do we have any more directives that we know we're looking at yet for school openings?
I know the state was going to be on a call with our superintendent, and because we had the day of over 5,000 as a state, that call was pulled. And it is really, because our numbers are growing locally, has really set the school district and both colleges back on what they're going to do. The school district was going to have a second summer session where they actually had students, but because of the increase in our numbers, they have moved to online for that. Honestly, as our numbers increase, it really is going to change what the school district's going to be willing to do. You know, if we have another 2 weeks of 300 or above, you know, it may end up where the school is just going to be online again because the numbers matter.
All right, thank you, Mayor. Scott, you have one more question, sir?
Yeah, Dr. Saravana, good morning. I don't want you to miss Dr. Fauci here in a minute, so just a quick question for you. I don't think we can go without asking you, how do you feel about what the governor decided and announced this morning?
Well, I guess, it's about time. And we could have done this a little sooner. And it's what we've been pushing for as a medical community. It is important that we curb this earlier than we did in the past so that we doesn't get to a point where we are forced to do what we did in the past, which is basically a shutdown. And so you can see the change in message, even in the governor's message from 1 week ago to 1 day ago. You can see a huge difference in that tone of message, in the urgency that's being posed. We'd like for our community as well to hear that, to see that, and understand how important it is for us to act on our own. And if we don't, then we will be forced to act a certain way. So that's I guess my comment for today.
Thank you, sir.
All right. We will be back on Monday, since we're going to do Monday, Wednesday, Friday. We'll just do it normal time again, 3 o'clock. Russell, did you want to finish us off with anything before we head into the weekend?
I hope you all have a good weekend. For those who tune into this, please be careful out there. Watch your group size, wear your mask, wash your hands. And 2 Corinthians 3:17 says, now the Lord is the Spirit, and where the Spirit of the Lord is, there is freedom. And y'all have a safe weekend. Be blessed.
Wear a mask.
Yeah.